The year was 1979. The oil embargo was greatly impacting the state of Michigan and especially employees in professions related to the auto industry. For several years, infant mortality rates that had been declining since World War II started to dramatically rise in big auto towns like Detroit, Benton Harbor, and Flint. Dr. Craig Blakely had just completed his PhD from Michigan State University and was asked to serve on a blue ribbon committee formed by the Michigan State Legislature to try and impact the rising infant mortality rates. Little did he know at that time that his work on this committee would contribute directly to policy change that would establish prenatal care as a basic health service in the state of Michigan. It also led to his writing A Pound of Prevention: The Case for Universal Maternity Care in the U.S., published by the American Public Health Association, a book that served as an early Bible for those advocating universal access to maternity care in the United States in the 1990s.
That book really set the stage for not only broader availability of maternity care, but also things like the Affordable Care Act and so on. So from the very beginning, he had an enormous impact on public health, and it was a wonderful start.
Dr. Blakely was soon recruited to the Stanford Research Institute in California, where he began working on education policy change. But it wasn't long until he was again recruited, this time to Texas A&M University, to help build a public policy research institute.
I've always said about Craig that if I were ever thrust into the wilds of British Columbia and had to get out by myself on my own resources, he'd certainly be a person I'd want along with me, because he's a totally inventive guy. He's creative, great problem solver. But I think most of all is he's a person who would never give up. He would continue, and he would not accept bad circumstances. And he doesn't do that for others either. He doesn't accept bad things for other people.
Dr. Blakely worked at the Institute for most of the next decade, eventually establishing a public health policy program at the Institute, while completing a Master's of Public Health degree. In 1998, he was recruited yet again, but this time to help build a new school of public health at Texas A&M, the School of Rural Public Health. He was hired as the inaugural head of the Department of Health Policy and Management, which he helped develop into the largest department at the school.
The most important thing being a department head was to do what you could to keep the system from interfering with the faculty so that they could do what they needed to do to educate students and build research programs and move down the road, and at the same time advocate on behalf of your students.
Craig was a very student-oriented guy. In fact, the first good, firm memory I have of Craig was an urging me to participate in the after graduation party that he always had at his house. Can't even continue to say it's the same party because, of course, that's all now swimming pool and formal entertainment space. It used to be out under the trees. As you have or will hear, it's the package deal, all right? The good news when you get Craig is you get Karen.
I think that it's really important that one of the messages that doesn't ever get lost is how much Dr. Blakely did for the students. His students, whether it was in any of the other departments or health policy management students, he was always an advocate for them. He always stopped what he was doing to help them get on the right path. He gave a lot to the students and the faculty.
For 15 years, he contributed to the conception and growth of the School of Rural Public Health, also serving as Associate Dean for Research and Associate Dean for Academic Affairs, before becoming the school's second dean. It wasn't long before the school became ranked by U.S. News and World Reports as one of the top 25 graduate schools of public health in the nation.
Some of these things were dual or triads of responsibilities that he had to carry. And that was very, very important at the early stages of the school because we were small, few faculty, few students. We weren't getting that many research projects at that time. We had to grow, develop them anew. And we had to grow a student body so that we could have more support from the state legislature and meet our commitments to the communities. And so we need to have several people doing several things and not just one thing. And he was stellar in that type of activity, and I can never forget that.
I've been on SRPH since 2001, so I've had the opportunity to work with Dr. Blakely in various different capacities. I was initially in health policy and management when he served as the department head. And we were working on Rural Health People 2010, and Dr. Gam suggested that I go speak with Dr. Blakely about the chapter that he was writing on substance abuse and prevention. And that was really my first experience meeting him. And so I remember walking in his office, and literally in the course of 5 to 10 minutes, he had outlined the entire chapter, including references, completely off the top of his head. And I remember walking out of the office thinking, wow, I need more paper, and he is a different kind of investigator. Dr. Blakely will always say, you know, a rising tide raises all ships. And so I really came to appreciate that, because I realized, you know, that he's not just an advocate for the faculty and the staff and the students. He's really an advocate for, you know, health and public health across Texas and the nation. And so, you know, he's a person that really believes in public health, and he demonstrates that every day in his leadership.
Under Dr. Blakely's direction, the school has expanded into undergraduate public health education, stimulated growth of regional campuses, and invested resources into the growth of doctoral programs. Further, he helped position the school to take on increasingly critical roles in health policy assessments in the state.
Craig has a brilliant mind. The dean's office can be an extremely fast-paced environment, and it suited Craig really well because he is a quick thinker, a fast analyzer, and a thoughtful decision maker.
Probably the one thing that I always admired most about Dr. Blakely is the fact that regardless of the situation, he always remains cool and calm. He's very decisive.
Dr. Blakely served as an Intergovernmental Personnel Act visiting scholar with the Substance Abuse and Mental Health Services Administration of Washington, D.C., and served on numerous committees in Texas, including the Texas Public Health Funding and Policy Committee and the Texas Medicaid Executive Waiver Committee. He also served on the board of directors for the Association of Schools of Public Health and as an international advisor to the Nigerian Center for Disease Control and Prevention.
Craig has just done a remarkable job in not quite 4 years. He has continued that trajectory set by Dr. Samaya. The size of the school, the diversity of the students, the quality of the graduates has continued to not just thrive but grow under Craig's leadership.
But it's been really fun to build a school from a blank drawing board with a couple of good friends. And to look back now, this many years later, and see what we've accomplished, and now we're of course all watching the students that have graduated and what they're doing, and that's what academia I think is all about, is the pyramid approach to impacting things.
I will always remember Craig Blakely for his humanity. He treated the receptionist at the front desk as well as he did any vice president that entered the door. I don't think there's a better measure of a man, of a leader, than that.
Craig leaves this institution in a much better condition than it was when he came. Not to say that there was anything wrong, but he's taken it and built upon it. And those of you who know Craig know he's a tinkerer, and he likes to build, and he likes to do, and he likes projects. And much as he's done with his house in College Station, where he's added here and added there and converted rooms, he's come to the deanship of the School of Rural Public Health and took what was a fine structure and he's added more to it and done it in a way with quality and class. He'll be missed, and our loss obviously is Louisville's gain.